My name's Julie Reyes. I'm a palliative care nurse at one of the local hospitals here in Las Cruces. I've worked with many families over the years that have been dealing with serious illness, and I've guided them and their families through difficult decisions. However, I would like to talk to you a little bit about my own personal experience with my dad. My dad is a Vietnam veteran, and he suffered a serious back injury about 30 years ago that developed and left him with severe pain and neuropathy in his legs and hands. My dad came to live with us a few years ago, and I was able to watch how that pain impacted his daily life. There were times he stayed in a dark room all day and just tried to get through the misery of his pain. It was very difficult to watch because this is not how he envisioned his retirement years. I was able to set my dad up with a palliative care provider here in Las Cruces. And after all the appropriate testing was done, my dad was able to be started on a pain regimen. The neurosurgeon was able to set my dad up with physical therapy, and after all these things were completed, he was able to start doing things that were important to him in his retirement years. Although my dad's condition wasn't life-threatening, we did decide to complete an advanced care directive, or goals of care. And while as a palliative care nurse, I've helped guide many families and patients through these decisions, I had not yet done this with my dad. We were able to have many discussions that talked about what he would want in the event he was no longer able to make decisions for himself and I needed to step in and make those decisions. We talked about things like CPR or cardiopulmonary resuscitation, being on a ventilator, being able to eat or drink or having to be fed through a tube. We talked about how things would look if he were not in his normal state of health, and what he would want done if he were wheelchair bound or bed bound or developed incontinence or any other multitude of symptoms that we find ourselves dealing with as we age. I was able to determine that my dad had never really thought about himself other than as in his current state. And having this discussion, although tearful at times, we were able to move through the different decisions he would want if he were not able to make those decisions, what he would want me to do for him. I want to reassure you that you don't have to be a palliative care nurse in order to lead this discussion with you and your family. There are many resources online. Prepare for Your Care or 5 Wishes are some of my favorites that help guide you through the document. And oftentimes there's videos that will guide you through how to have these discussions, because these are very difficult discussions to bring up, and I think it's important that no matter what happens, that you have the discussion.